Fascia responds best to safety, not force. We're taught that when we're tight, we should go stretch harder, work that out. And that makes sense logically, but fascia works differently. Because fascia is connective tissue that runs through our whole body, connects everything. It's full of proprioceptors, which gives sensory information to the nervous system, to the brain, to decide whether or not something is safe. It's constantly giving signals to the nervous system, where you are in space, what you're seeing, what you're hearing, what you're feeling, whether the environment is safe or not. So when our bodies are tight or chronically tense, this is not your fascia doing something badly or failing at its job. Your fascia is doing the job of protecting you. That's its job. Gather data, send data to the brain, determine whether or not we're safe or whether we need to guard some more. So in terms of fascia, if we are using too much force, that backfires with what we're trying to do. What we're trying to do is get looser, not be in chronic tension and pain, but it's our nervous system that decides whether or not we're safe. Because if you're putting a lot of force into your system and your fascia is like, this feels like threat. And what happens when you feel threatened? You guard. That's how your body is set up to protect you, create some safety. And sometimes after people have gotten a really aggressive amount of body work or aggressive session, they get tighter afterwards. And it's not because their body is resisting change, but it's protecting you. What does create change is safety. Safety allows the fascia to soften and change. But safety is not doing nothing, because your brain requires 3 things to survive. It needs oxygen, it needs glucose for energy, and it needs movement, also called proprioception. So we need to be doing some gentle and consistent input if we want the fascia to send better signals to the brain so that we're not guarding and bracing all the time. Those changes need to be small and slow and consistent because the body needs to be able to absorb and integrate input in order to create some sustaining change. If we allow gentle work, we can work towards getting some deeper, more longer lasting, consistent change so that we stop walking around like this. And when our bodies recognize that softer, gentler can help the nervous system regulate, then the tissues can reorganize and sustainable change can happen instead of temporary, maybe intense change. So safety before softness is one of the core principles of neurofascial flow method work. It's a 5-step cycle. There is creating safety, getting some softness into the tissues in the fascia, then asking the body to accept some change, then adding some safety back in, and allowing the body to integrate it. So there's a safety sandwich every time we want to incorporate some change to our system. And that's what allows the fascia to feel safe and create those longer lasting changes, rather than that felt great and it's 2 days later and now I'm right back to where I started. We also do with neurofascial flow in the unwinding is do a feet to head progression, because we want to unwind all the tension that comes up the body, not starting here, but starting from the feet so that our whole system unwinds and Our body knows that it's safe to unwind and relax and release a lot of that upper body tension where most of us carry it. And the goal is to create change gradually enough for those patterns to hold the change. Because fascia changes best when it feels safe enough to soften and not when it's forced to stretch.